how is the life like after someone living with multiple myeloma?
That's a very good question. So long term, we are looking at giving, especially if we are treating patients in their 50s or 60s, we are looking at giving them a good quality of life or standard of life, post completion of treatment. So as I said, these patients they don't receive chemotherapy, which would cause hair loss, a lot of oral ulcers and severe weakness. Not really the goal to keep them in the hospital. But with the combination of this immune therapy and immunomodulator therapy, and even after transplant, during the period of transplant, patients have to be, confined to their homes for at least about 2 weeks post transplant and discharged from the hospital. But after that, once the physician, the hematologist feels that their immune system is back to normal, they're able to lead a normal life. They may still have to take tablets, or in some patients maybe once every 2 weeks they may have to come for an injection to the hospital. But apart from that, they have almost normal immune systems. They're free to travel. They're free to lead a good normal healthy lifestyle.
Is there any family members as or the caregivers how they can support the people who are suffering from multiple myeloma?
Yes, so I think number one point to address here would be to remove the stigma that comes with cancer in India. So as a physician who's trained in the West, I have seen a huge difference in the way we handle, or in the way we approach cancers or various diseases. So it is always helpful for the patient. Of course, it's going to be a little difficult to be positive because they are worried about their future health state. But for the people around, the family, the patient's friends, close caregivers, it is very helpful for the patient if you have a positive outlook. If, as the patient's caregivers or family, you are not able to speak positively about their future life, see how to cure the condition and then take them to a normal lifestyle as much as possible, then it is going to be very difficult. It will have a heavily negative impact on the patient themselves because they are going through treatment. So having a positive outlook or positive mindset, how do we take this head on and cure it completely, rather than, oh my god, I have been diagnosed with a big medical condition, maybe there is no treatment for it, maybe I'm going to die from it in the next few months. No, so you have to put aside the negative sort of thought process and see how to tackle the process, the disease head on, by contacting the right specialist for it, by contacting the right center, trying to undergo what is the best treatment, the latest treatment for that particular disease. So try to be as supportive of any person who has any type of a cancer, whether it is blood cancer or myeloma or anything else.
Doctor, are there any upcoming events or campaign or organization working to support myeloma patients?
From being a hematologist, I know sometimes how difficult it can be to find the right doctor to decide about continuing treatment, what is the best treatment. So the best we can do here at Therapy is try to offer you a free second opinion. If you've been diagnosed with multiple myeloma, you're welcome to reach out to us. So we can give you a free second opinion as to what is the best way going forward. Apart from that, how to create awareness. So March is the month of myeloma awareness, and that is the reason we are making this video. So it is very important. If we are not aware about a particular condition, then it is going to be difficult to pick up. Although the condition is there in the community or in the society, if the right doctors who are seeing the patients at the first visit, it could be a physician, it could be an orthopedician seeing a patient with low back pain, could be a nephrologist who's seeing a patient for kidney dysfunction. If these doctors are not able to pick up on multiple things going on, the subtle findings, and refer to a correct specialist, then we may miss out thousands and maybe even hundreds of thousands of patients with myeloma. So creating awareness about the disorder is extremely important, so that a life-threatening disease like myeloma is not missed, especially a condition which can be treated, and we have good promising treatment available for. So feel free to watch this video and spread it amongst your friends, your family, your colleagues who are in India, outside India. Make sure that you spread the word about myeloma, and let's see how we can all contribute to this important cause during this month.
How can viewers get involved or help in fighting against myeloma?
So any medical diagnosis has two parts to it, right? One being aware, getting diagnosed, and second part is the treatment. So I have already spoken about how we can be more aware and how we can spread the word by sending across these videos, speaking about this important medical condition with various people surrounding you. So maybe family, friends, colleagues, your employers, anybody it is. Apart from that, to help patients. So the next half is where patients require treatment. Although myeloma treatment is not very expensive, it does require a long therapy. treatments like stem cell transplant, or once CAR T is approved, these treatments tend to be quite expensive. So it is possible to help out the community if you have either known a patient with myeloma or you yourself have been a patient with myeloma. You know what journey these patients go through. So financially, some patients might require help. With this thought in mind, we have created a trust called Navajiva Trust. We will include the details of this trust in our video. Feel free to visit the website and make whatever generous contribution you can, so we can help the patients to the maximum extent possible. Thank you.